Well, good afternoon. You're listening to the new WCEG Network on WCEGTalkRadio.com. Click your live stream tab or watch us live on your smart TV, YouTube, X, Facebook, and LinkedIn. I'm Celeste Giordano with CelesteGiordano.com, your show host, along with my co-host, Sara Poe with Poe's Accounting Services. This is the Global Legacy and Wealth Building for the next hour. Let me start over. Well, good afternoon. You're listening to the new WCEG Network on WCEGTalkRadio.com. Click your live stream tab, watch us live on your smart TV, YouTube, X, Facebook, and LinkedIn, WCEG Network. I'm Celeste Giordano with Celeste Giordano, your show host. My co-host tonight is Sara Poe with Poe's Accounting Services. This is the Global Legacy and Wealth Building Hour. We're the worldwide community empowerment group where we speak life in the community. Subscribe to our YouTube channel, WCEG Network. Like and follow and connect with us on Facebook, X, Instagram, and LinkedIn. We also have new platforms with Apple. Just search WCEG Network. And last but not least, our disclaimer: the topics and opinions are those of the show host and guest and not WCEG Network. Thank you for your continued support. And hello, ladies. How are you today?
Hey, Celeste.
So good to see. So good to see you, Sara, and have you this whole month of October as my co-host. So I'm excited for that. And I am just super excited that we have Bonnie Dobbs back with us again today. And this, I think, Bonnie, is either your fourth or fifth time on the show with WCEG Network. And, you know, October is a busy, busy month for both of you. And we are just super excited to interview you today. But first, I want to thank Penny Rogers and WCEG Network for this platform that they present for us to bring people like you, Bonnie, and our guest that we have on October 28th, Kim Schooler. You know, both of you have been our stand-in, solid, confirmed guest for October. And I want to say this is the 5th year. So Penny and the board, thank you so much for giving us this opportunity to bring this amazing lady today, and Kim and later on this month. How are you doing today?
Absolutely wonderful. And thank you, Celeste and Penny and Sara, for being on the show. And I just want you guys to know I really appreciate and I feel honored to be a part of this every year. And I hope I bring information to the table that you all can take with you for the rest of the year, actually. So thank you again.
Absolutely. And Sara, how are you doing? I mean, tomorrow's the big deadline, right?
Yeah, it's the second one. We got one more to go in November, but yeah.
Absolutely. Everything doing good with Poe's Accounting Services and everything?
Yeah, doing well.
Well, good. Well, it's always an honor and a privilege to host both of you, especially you, Sara. I always enjoy having you as my co-host.
Well,
and, you know, this is one of our favorite months, you and I, to get to come together and bring people like Bonnie Dobbs with us and talk about Medicare and other red tape. And Bonnie never disappoints us with the information that she brings to the table. And what I'd like to do is read Bonnie's bio for our listeners and audience. And for those of you listening, if you have any questions, please put them in the chat. We're monitoring the chat. We'll get your questions answered to the best of our ability. And so we're going to get started. Bonnie Dobbs is the founder of Insurance and Other Red Tape. She knows firsthand how confusing and frustrating Medicare can be. Her journey begins as a frequent visitor to a loved one in memory care, where she saw just how complex the system was for families. That experience sparked a mission to make Medicare understandably and less stressful for everyone. For the past 15 years, Bonnie has become one of the most sought after medical care educators in the country. She's a trusted author, panelist, and speaker who has taught thousands through webinars, live events, and print media. Before the COVID pandemic, the Atlanta Journal-Constitution chose her as the Medicare expert for their entire Aging in Atlanta panel against series for 5 consecutive years. For the past 5 years, she has written articles on Medicare in the Ask the Expert, Aging in Atlanta section of the AJC. Her most recent article just came out on Sunday, October 5th. Whether you're turning 65 or preparing to retire, already on Medicare, or caring for a loved one who is, this
Yeah.
program is for you. Wow, Bonnie.
Yeah, a lot going on.
A lot going on. And it starts for you tomorrow as well, right?
Oh, yes, absolutely. Tomorrow's the big kickoff day.
Well, and I also hear there's big disruptions in Medicare for 2026.
You have no idea. There's so many of them. It's got everybody's head spinning this year. So, for Medicare Advantage plans, okay, for people who are on the Advantage plan, the major companies in the greater Atlanta area, some of them are terminating their plans. Some of them are having something called crossovers, meaning they're on a plan now, but that plan will not be offered next year. And so they're going to put them on a plan similar. But one of the largest companies is completely doing away with all of their PPOs except for one. And then I have another company, and I just found out this is hot off the press news. Okay. I found out early this morning, yeah, that they are not going to be offering Medicare Advantage plans except for people who are on Medicare and Medicaid, and those plans are called dual, or if they qualify for veterans benefits. This is going to affect, well, number one, this company is doing this across America. There's 1 million people across America being affected. Atlanta is one of the largest that's being affected. So, folks, I'm saying it first. If you're on a United Healthcare Advantage plan, you need to change your plan unless you're on Medicare and Medicaid, or if you're a veteran, because those plans, those Medicare Advantage plans are going away.
And this is just a follow-up question. Why do you think that is? Why do you think all this disruption?
Because the plans that are available are, they have low premiums and lots of good benefits. So rather than change to another plan, they just decided for 2026 not to offer any more. They will retain the business that they have in other markets, okay, but very limited business here in Atlanta. The other thing is Humana and Aetna, and let's throw in Blue Cross Blue Shield. So all of the largest companies across America that offer Medicare Advantage plans, they are terminating so many of their plans. So for everybody who's on an Advantage plan, they need to seek out a broker. Don't call the company that's on your card, because if you call the company that's on your card, they're going to put you in whatever plan they have. Okay, except United, they're not going to put anybody in a plan unless they're Medicare and Medicaid or VA. Okay, so call a broker, and a broker is somebody who can compare every single plan that is available to you. Okay, so it's going to mean The majority of the people in Atlanta, it doesn't matter what Advantage plan you're on almost, you're probably going to have to change your Advantage plan this year.
Mm.
What's going to happen is what you and I were talking about a little bit before. Some of these procrastinator people, they think they're the only people in the world, you know, there's 63 million people that are on Medicare. So don't wait. Call today, call tomorrow, get on the schedule. Because if you don't, you're going to find yourself at the end of this trying to figure it out by yourself because there's not enough agents to help that many people. And you, once again, you want to make sure that you use a broker because a broker's contracted with all the companies, okay, or should be, so that they can shop it for you. Because if you call an agent and they just work for one specific company, that's the only company that they can check plans with. And that so they don't have the ability to check all the plans that are available to you. So make sure that you call a broker so that you can do that.
So Bonnie, for our audience and listeners, I want to get it out there very front and center. You are a broker, Bonnie Dobbs,
Yes.
right?
Yes.
Insurance and other redtape.com. And your phone number is 770-373-7541. Is that correct?
That is correct. And I have 15 agents. We're in a lot of states, not just Georgia. So if you're Medicare eligible or you have family and friends that live, whether they're in Georgia or in other states, we can help you. Okay. And I've trained every one of my agents. I have some of the top agents in the country. I'm very proud of my agents. So you can call and we can do that comparison for you.
All right. And we have a quick question that could you please repeat your opening statement, that hot off the press statement, please, for an audience, please?
There's so much disruption that's affecting Medicare Advantage plans this year, and it's all the major companies. So it's Blue Cross Blue Shield, Aetna, Humana, United. All of those companies are being affected by this. And what they're doing is they are terminating plans. So if you're on a Medicare Advantage plan, you need to contact a broker and have someone who can compare every plan that is available to you.
So what is the difference in an HMO and a PPO?
Oh God, I'm so glad you asked that. That is huge. And people on Advantage plans need to really understand this. So on your card, it will have either HMO or PPO on it. If you're on an HMO, that means in network only.
Okay.
So if you go out of the network and don't get a referral from your primary care doctor, you get to pay the entire bill.
Ooh.
So everybody, if you're on an Advantage plan, look and see if you're on an HMO or a PPO. Because if you're on an HMO, you must get all of your care in the network unless you get a referral from your primary care, your PCP. Now, for those who are on a PPO, okay, you pay more if you go out of the network, but they do provide the flexibility for you to go in the network or out of the network. You'll just pay a little bit higher copay. But it's really important for those who are on an HMO to know the rules, because how would you feel if you went and had some expensive procedure, didn't realize you were out of the network because you didn't bother calling and confirming, and now you got to pay the whole bill. So it's extremely important people understand the plan they're on and the rules that go along with that plan. And this is what most agents don't take the time to go over and explain. And then people find themselves in financial trouble. Good question.
Now I got a question, a follow-up question. So in
Okay.
an area like Atlanta, is that as big of a deal in an area like this as opposed to say like South Georgia, where you don't have as many doctors and hospitals?
It's really a big deal. It's really a big deal because if you're in a rural area, okay, if you're in a rural area and you really need to find out what doctors and providers are near you. Okay. There are plans called PFFS. So instead of having HMO or PPO, the PFFS plans were created for people that do live in rural areas. So if you live in the metro area, you'd probably never have these plans, okay, because they were really designed for people that live in rural areas. It gives them a little bit more flexibility, but at the same time, every time they go to the provider, they have to confirm that that provider is going to accept the terms and the payment that that plan offers. So you could go to a doctor one time and they go, yeah, yeah, come on down, call them next month. And they were like, no, we decided we're not going to do that,
Oh, wow. Okay.
So, that's the reason why you don't find those in the metro area because the HMO or the PPO gives you better coverage. Okay, with the PFFS, you don't know, but it gives you flexibility
Gives you
to
some
go to
flexibility.
different
Okay.
doctors. Exactly, exactly.
Very good. So let me ask you this, how is this going to affect prescription drug plans?
Oh, yeah, that's a good question. So, um, I don't want to start talking about politics, so I'm just going to leave that part out. But um, last year or year before last, okay, you could pay up to $8,000 for your medications. Starting in 2025, they have a cap of $2,000. Now, next year, that cap is going to be raised to $2,100. This year, the deductible is $590 or up to $590. Next year, they're increasing it up to $615. Okay. And because the deductible is cost so much, and it was really creating a hardship on people who just are living off Social Security. At the beginning of the year, the first time you go get that prescription fill, if you're on a tier 3, 4, or 5, yeah, you got to come up with that 590 or next year 615. So they created a plan, and all pharmacies honor this. Instead of that big hit with that large deductible, what they did is they started dividing the total cost of your deductible and your medications by 12 months. Now, because it was a new program that began this year, a lot of people didn't know about it in January, and sometimes it may be February or March before you actually go get the first fill because you may have medication left over from the previous year. So, whatever month you go, they divide that number into equal parts. Okay. So over the 12-month period, instead of having the high deductible out of pocket in one at the first fill, it's divided equally over the rest of the months for the remainder of the year. So that's good. That program is still going to be available for 2026. Okay. But whenever I started doing this, drug plans didn't have a deductible. There was no deductible. And now to think about 15 years later, the deductible for a drug plan is $615. That's a lot of money for people who live off of Social Security.
Oh, absolutely.
So Yeah, so that's what's going on with drug plans. Plus, remember I told you the year before in 2023, you could pay up to $8,000 out of pocket for your drugs. Then starting last year, it was 2,000. So we went from 8,000 to 2,000, and there was basically like 1% of America paid that kind of money for their medications. But what that happened is now the insurance company is having to eat that $6,000. So it has caused the premiums to skyrocket. So that's the ugliness that's going on with prescription drug plans this year.
So a follow-up question. So do the, where you go get your prescriptions, the drugstores, wherever you go.
Pharmacy? Yeah, yeah.
Pharmacy. Thank you. That was the word. I
Sure.
just couldn't put
That's
it in
okay.
place there. Do
It's
they,
late.
do all of them automatically break that down for you, or do you have to request it?
Yeah, you request it. So, some people may not have a financial problem and they want to go ahead and pay the deductible and get it out of the way. Okay. So, but if you do want to break it down into equal amounts, then you can tell them whenever you go get your first fill and they'll do that accordingly. Yes.
Yeah, I'm one of those ones. I just want to pay the first time and be done with it.
Yeah, yeah. And some people are like that. And as we get older, if we are getting money from our investments to help us throughout the year, sometimes people get all their money at once at the beginning,
Right.
rather than get it monthly or quarterly or semi-annually or whatever. So yes, I do have people they want to pay for it, get it out of the way. Uh, Folks who have not saved, those are the people that usually want to break it down into payments.
Sure.
Absolutely. And not everybody is in that situation that they can afford to pay it all at one time up front.
Right.
They're having a hard time, and they
Sure.
need every penny they can get in their pocket. So,
Absolutely. So, what will Part B premium and deductible cost be in 2026?
Oh my God. Yeah. So, first of all, when I first started doing this, the Part B each year was $94.80. And then the next year was $99.80. And then the next year was $104.80. And then the next year we had the hugest increase. I couldn't believe it. It went from 104.80 to 111.80. It's like, oh my God, the world's coming to an end. Because whenever I started doing it, well, it only increased like by $5 each year. Now, this year, your Part B premium is $185. Now, if you're low income, the federal government pays it. If you're middle America, what most people pay is $185. If you're high income, there's a chart and you can pay more in increments up to $750,000 or more. And if you do qualify for the highest amount, your monthly premium, instead of being that $185, is like $500 a month. Okay. But this year, instead of going up $5, it's going from 185 to the projected amount is over $206 a month.
Wow.
That's a huge jump from the humble beginnings that started out 15 years or whenever I started out 15 years ago. The Part B deductible this year is $257 and it's increasing to $288, or that's the projected. Now, the federal government always sets the cost for the Part A and Part B premium and deductible, and they haven't released those figures for 2026. That's the reason why I reiterate that's the projected increase. So that would average out to about 11% on the premium and about 12% on the deductible. That's a
Wow.
lot. That's a lot. Yeah.
a lot. That is a lot. So, what is the annual notice of change, and why is it so important this year?
Okay, so every year when you're on an Advantage plan or a prescription drug plan. During the month of September, they send out letters called the annual notice of change or coverage. And what you can do is it compares your premiums, your costs, your providers, and your benefits with this year's plan, the plan you're currently on, with next year's plan. So if you don't do anything, you can look and see what those increases or costs are going to be, if your providers are going to be in the network, and what benefits are they going to increase benefits or decrease benefits or charge you more, whatever. So this year, many people, when they got their annual notice of coverage, or change, it did not have next year's options because that plan is not going to be available next year. So they have to get these mailed out no later than October the 1st. So this is what started happening. Just in the past couple of days, people are receiving their annual notice of coverage and they're calling saying, guess what? My plan's not being renewed. In order for me to get a plan, I got to change. I got to change plans. So I'm not kidding you. My phone, I've got three lines here. My phone, all three lines have been lit up all at once. And I always hire more people this time of year to man the phones and to help out in the office. And they couldn't keep up. I mean, it has been chaotic because, like I said in the beginning of this, so many companies that are terminating plans and people have to change the plan. So that's the reason the annual notice of change is so important. Now, Atlanta doesn't have the most reliable mail service. So everywhere I have been speaking, I tell them, call the 800 number on the back of your card. I don't care what company you're with, okay? And make sure you can stay on that plan and it'll be available next year. But if it's not, you're being forced to change plans or you're not going to have Medicare coverage. Then you're going to put yourself in the position that you are going to get a penalty, and penalties are for life. They never go away. So that's the reason why this year that annual notice of change is so important.
All right, for our audience and listeners, I want you to repeat that sentence again to them, that they need to call the number on the back of their card and explain why they need to do that.
Yes. So if you didn't receive an annual notice of change, then you need to call the 800 number on the back of your insurance card and ask if your plan is being terminated. Now, if it is, just say okay and hang up. Call a broker. Do not say what plans you have available because they can only go over the plans that's in their portfolio. They cannot compare all the other plans, okay? And you want to, this year more than ever, you want to have your plans change because there is so much disruption. So many of the companies are increasing cost and decreasing benefits. So my whole goal is to educate everybody and make sure that they get the most benefits that they possibly can. So call the 800 number on the back of the card and find out if your plan is being terminated. If it is, call a broker. Or if you get your annual notice of change and it does compare this year with next year and there's almost no difference, then you can just stay on the plan you're on and it will just roll over. Okay. But there's going to be far and few of those available this year.
Absolutely. And Bonnie Dobbs is a broker. And again, Bonnie Dobbs' phone number is 770-373-7541, or go to our website, www.insuranceandotherredtape.com. and talk to her or one of her agents there. She can direct you to, they will direct you to somebody that can answer your questions. So please, please make sure you reach out to Bonnie Dobbs with any of those questions right there.
So Bonnie, I'm going to be 65 next year. And I'm starting to get these phone calls, right? Saying they're from Medicare. Are they legitimate calls? Same thing
First
with
of all,
mail.
happy birthday.
Oh, thank you.
So, no, they're not. If anybody calls you and says they're from Medicare, they are not from Medicare, because Medicare, Social Security, the IRS will never call you. They contact you through snail mail, okay? Unless you've got ongoing dialogue. Now, if you call them, you guys are talking back and forth, that's a different story. But other than that, okay, they contact you initially via mail. So if your phone rings and you don't recognize the number, don't answer it. They're doing one or two things. They're either wanting to sell you something, or they're wanting to steal your identity. And I've got a little story. So this actually happened this year in Cherokee County to a husband and wife, client of mine. They're home one afternoon, they're bored, they get a phone call, some nice voice over the phone. Oh, we've got this fabulous plan, and let me go over it. And they go over it, and the husband and wife decides to enroll in it. And when you enroll in a plan, you got to give them all of your information, right? Everything. Well, once they got off the phone, or by the time they got off the phone, the wife looked at the husband and said, I don't feel good about this. Let's call Bonnie. Oh, darn. Why didn't they call me before? Right?
Mhm.
They talked to finish the conversation. So this is what happened. Somebody made up a company and a plan that does not exist, and they use that to steal their identity.
Wow. What a nightmare.
So they had to call the CMS, okay, the governing force over Medicare and Medicaid. They called the CMS, they reinstated them with the plan that I had put them on, but now they got to go through the hassle of identity fraud. And we all know that is no picnic.
No.
So if somebody calls you on the phone and tells you they're with Social Security or Medicare or the IRS, or what's the other thing? The thing in like the Peach Pass, okay?
Oh, yeah. You got
Yeah.
tolls you got to pay. Yeah.
No, they're not. No, they're not. They're going to send you a letter in the mail. So just don't answer that. Just don't answer those calls. But thank you for asking that, because so many people think, oh, this is Medicare calling me. It's something important, or and they believe whatever the person says on the other end of the line, because those are professionals, okay? Out to steal your identity. They're identity thieves.
Absolutely. And Bonnie, I want to make a little follow up on this for our audience and listeners. Many of us are taking care of aging parents and things of this nature. And it's so, so important to educate our aging parents about that specific thing, because so many people take advantage of the elderly, and that you just don't give your personal information to anybody on that phone. Right there.
Exactly.
So please, if you're a caregiver for an aging parent or relative, please have a conversation with them and make sure they understand not to give their personal information out.
And that is
Absolutely.
the reason why I have already made an appointment with Bonnie for January.
And I look forward to it right after the holidays. That's right. It's your turn.
All right. So Bonnie, when should you enroll in Medicare?
Well, there's 3 different times that you become Medicare eligible. One is if you're turning 65, like Sarah. So Sarah will have the 3 months before her birthday month, the month of her birthday, and 3 months after. Now, what I tell everybody, sure, you can wait till 3 months after, but unless you're working for an employer, you're not going to have any insurance, and nobody wants to put themselves in that situation. So we always like to start working with people 3 months prior to their birthday. Okay, so that's the reason why Sarah said we've got an appointment right after the holidays. Okay, we'll go ahead and get things started. And what we do is we walk you and guide you each step of the way from the insurance that you're on into Medicare. We never like to give anybody a laundry list of things to do. We give you one piece of homework at a time. We make sure that you have continuous coverage, that you don't get a penalty, and that you get enrolled on time. We take all the guesswork out of it. We give you one step, you complete that, then we go to the next step. Okay, we keep you on schedule so people feel comfortable calling us because you don't have to think about it. We got it down to an art form, okay? And we're going to educate you along the way. So you have a much better understanding whenever you're not in a rush, and we can break it down one step at a time. You understand what's going on, and the more you understand about the process and which plan you choose and how it works with Medicare, the better you are at making smart decisions and not getting a penalty or paying for things later on. Okay. So if you're turning 65, you've got that 7 month window. Now, many people are working past 65. So for those who are working past 65, you must be working for a company that has 20 or more employees. That's the buzzword right there to prevent you from getting a penalty. Because if the company has 20 employees or more, it's Medicare eligible, or excuse me, equivalent, Medicare equivalent insurance. Okay. And you can continue working and delaying your Part B as long as you work. Okay. So just remember, as long as you work for a company that has 20 employees or more, you can delay enrolling in Part B. The third time is if you are under 65 and own disability. Now, first of all, if you're under 65 and own disability, something has probably happened. Maybe you were in a bad wreck. Maybe you had a stroke, but something has I mean, you need to have 2 years, okay? And within that 2 years, if you do rehabilitate from whatever, okay, then you go back to your regular insurance. However, if during those 2 years you do not rehabilitate, then you're deemed Medicare eligible in that 25th month. So if you're turning 65, you got a 7 month period. If you're retiring past 65, you can work as long as you want, as long as the company has 20 employees or more. If you're on disability and under 65, in that 25th month, you're deemed disabled and you qualify for Medicare. Does that answer your question? Good.
Yeah.
All right, I want to dissect that a little bit more, Bonnie. So,
Yeah.
so what if somebody, you turn 65, you're required to sign up for, what are you required to sign up for? If you're working and you have good insurance at 65, you're required to sign up for a certain part?
Nothing.
But what if you sign up for a certain part?
Okay, if you sign, okay, so number one, if you're working for a company and you're contributing to an HSA, you can't be in any part of Medicare. No Part A, no Part B, no nothing. Okay. If you're not contributing to an HSA, okay,
Okay.
then you can go ahead and leave your Part A because you don't have any premium, okay, for Part A. You want to delay enrolling in Part B, okay, until you no longer have your coverage. And let me tell you a little story. So I have this lady, she gave me a call and she was like, my mom worked for 20 years for a company. She retired, but then she went to work driving a school bus because school bus drivers get insurance. what she didn't do was she left her mother on Part B. And so her mother drove that school bus and paid Part B, which this year, remember, it's $185. She had worked for the school system so long, by the time she came and told me the story, her mother had paid more than $10,000 into Part B. It's like taking the money and throwing it out the window because they're not going to give it back to you. Okay. So if you're working for a company and they have 20 employees or more, delay enrolling in Part B. It's just like throwing the money out the window.
What if,
And thank you for asking me to clarify that. That's very important. And it's one of it's a thing that so many people don't know, and they've wasted all that money. Well, gosh, she could really have used that money whenever she retired.
Well,
absolutely,
isn't there another part that you could enroll, but you're not charged a premium or something, but you enroll, is it Part D or Part C?
Part
and
A.
All right, so explain that, please.
Okay, well, that will take me back to the beginning of Medicare. So we did not talk about A, B, C, and D. So A and B is on your Medicare card. Part A is all inpatient. Part B is outpatient. The way you get Part A is during your working years, you pay into FICA taxes. Well, FICA taxes, that is Medicare taxes. Once you've worked for 10 years, which is equivalent to 40 quarters, you have self-funded your Part A. So when you become Medicare eligible, there's no additional premium. Okay. So for Part A, if you're contributing to an HSA, you can't be an A or B. Okay. If you're not contributing, you can go ahead and let your Part A start because you don't have any more premium for that. Okay.
Okay.
Part B, you don't want to start it until you become Medicare eligible. Okay. So you're going to either do that at 65, or if you're retiring past 65, wait until you are retired. Or if you're under 65, in that 25th month, you get A and B. Okay.
All
Now,
right.
Part D is a drug plan. And once again, same rules apply. If you're working for a company, you'll want to delay enrolling in Part B and D.
All right. And Sarah may know this. Is 70 the last time, or have they bumped it up to 71, Sarah?
I think it's 71 and a half now.
Oh, I
For,
thought it was 72. You're talking
yes,
about delaying,
delaying it.
oh God, what do you call that? Taking
The
min-
RMDs,
what is it? Minimum
RMDs,
what is that?
retired, RMD.
Minimum benefit, right?
Distribution, yes,
Right.
yeah.
Distribution. Yeah, there you go. Yeah. So I'm thinking it's 72. I think they just did
It
that
just went to
recently.
72. It was 70, then 71. Now it's 72. Yes.
Okay.
Yeah.
So the second part to my question is, we talked about the A, B, C, D, whatever. When can you change your Medicare plan?
Oh, that's a good question. So if you're on a Medicare supplement plan, okay, then once you turn 65, and as long as you're enrolled in Part A and B, you can change your supplement plan any month you medically qualify. Now, when you first become Medicare eligible, you have the first 6 months you can get on any supplement plan with any company, no underwriting. With the Advantage plans, those are specific times, Advantage plans and drug plans. So with those plans, it's October the 15th, which, oh wow, tomorrow's the big kickoff day, okay, through December the 7th. And then there's also another time for those on Medicare Advantage plans, which is January the 1st to to March the 31st. Now that's called open enrollment for people on Advantage plans. So during annual enrollment, the October 15th to December 7th, if you choose a plan, take it for a test drive, and realize maybe you don't like that plan, or maybe your needs have changed or whatever, you can change your Advantage plan during open enrollment, which is January the 1st through March the 31st. And then there are some other times whenever you can change that plan. So for people who are on Medicare Advantage plans only, when you move, okay, and it doesn't matter if you move across the street to a different county or a different state, because all Advantage plans and drug plans are service area specific. Okay. If you don't change your plan and you move out of your service area, the federal government will say, okay, you're out of your service area, and they'll knock you off that plan. And then you start accruing a penalty. And then you would have to wait until annual enrollment before you signed up or signed for another plan. Okay, so it's really important. There are a couple of other times for people that are on Advantage plans. So if you're being admitted or discharged from skilled nursing, now most people don't know that you have that option, but if you're going into skilled nursing, you're not having a good day. There is something that has drastically changed with your health. So the federal government will allow you to change when you're admitted or whenever you are discharged, because you go in there for some reason, you're in there for a while. Then when you rehabilitate and you're ready to be discharged, when you go home, maybe your doctors have changed, your medications have changed. You may have to end up moving across the country near family or friends or whatever. So then you get that opportunity again to switch plans. Now, for Advantage plans and drug plans, there are several other times, special election periods. One bit would be also if you became qualified for Medicaid, or if you lost Medicaid status, if you moved out of the country, or if you moved back in the country, or if you just got out of prison, because when you're in the prison, you're a ward of the state and they pay for your insurance. So once you get out, then you have to go get your own Medicare plan. And all these times usually have a small window of time, which is 2 months. So if you know anybody moving, whether they're moving across the country or, to the beach or whatever, or if they're going into a nursing home, if they're moving, they need to have their Advantage plan reviewed and their drug plan reviewed. And once again, you would want to contact a broker, because what I said, if you call the 800 number on the back of your card, they're going to put you in whatever plan they offer. If you call a broker, they're going to compare every plan that's available. And in your new service area, I don't care how good your plan was where you were before, since all of these plans differ county to county and state to state.
Right.
Yeah, the company that you're with, that could be the worst plan or the worst company in your new area. So find yourself a good broker who can compare every single plan that's available to you.
Absolutely. Sarah, we have about 11 minutes left, so we have time for some more questions.
Okay. So why have Medicare supplement plans had high increases in the past couple of years?
Oh gosh, I'm so glad you asked that. So this is what happened. Remember in 2020, we had something called COVID that shut down America. So for the next couple of years, okay, your doctor didn't want you coming into his office. You didn't want to go to the doctor's office and sure didn't want to go to the hospital. So nobody wanted to interact with anybody unless they absolutely had to. So the doctors weren't prescribing that you get certain tests unless it was absolutely necessary. And if you had a surgery, like, I don't know, maybe you needed knee replacement, but it wasn't killing you right now, you decided to wait until later. So nobody goes for a couple of years. And then finally, when it's safe to come out again, or when everybody felt like it was safe to come out again and interact without a mask, then everybody that had not gone to get that test or get that elective surgery, and every provider, felt comfortable now sending all their patients to get these things done. So in 2023, we saw everybody going to the doctor or the hospital or imaging center or whatever it was. So what did that do? It created a huge, huge burden on the Medicare supplement companies, because they went for a couple of years without very many, or with a much, much lower cost of doing business. But then when everybody went at one time, it was, oh my God, they felt like they had been robbed. The kitty was reduced drastically. So then in 2024, and also this year in 2025, the Medicare supplement plans, we've seen huge increases. I mean, some of the companies that I work for, I work with many of them, but some of them, I could basically depend on them to have like a 4 to 7% annual increase. They kept it down. But what happened last year and this year is those increases have skyrocketed. Like Mutual of Omaha had a 15% increase. Well, that's a big jump from, maybe a 7 to 10% increase. Because whenever you're talking about, say if you're paying $100, and I'm just using that for easy math purposes, okay. If your plan was $100 and your premium went up $7 a month, that wasn't a big deal. But when it started going up $15 a month, and it did it last year and then this year, that's
Huge.
now you're paying $30 more than you were 2 years ago.
2 years ago.
Exactly. And so, people were like, wow, this is really hitting me in the pocketbook. So unless you really have deep pockets and have saved accordingly for a supplement plan in your budget, but that's what's happened the past couple of years. And because of the high increases in everything to do with the medical industry, it will probably continue next year and probably into 2027 before we see it kind of leveling off and hopefully getting back to maybe the 4 to 7%. Now, one thing is we're lucky because we're in one of the states that doesn't have something called the birthday rule. The birthday rule is offered in several states, and what it does is a couple of months around your birthday, you have the opportunity to switch to any company or any plan. Well, the state of Illinois is the one that got hit the hardest, because I have one company, they had a 15% increase in Georgia, but you know what their increase in Illinois was? 40%.
Oh my goodness.
So you take that same $100 premium, and if it got increased last year $40 and this year $40, instead of paying 107 or 115, you're paying 180. that adds up really, really quick. So supplement plans, like I say, thank God we're not in one of the states that has the birthday rule. And if you ever hear it being voted on, do not vote for it. It will ruin supplements in any state. I mean, they become obsolete because nobody can afford them. Well, they don't come obsolete, but the general public can't afford that type of annual increase. So
Right.
thank you for asking that question. That was really good. I know it took me a long time to answer it, but I always like to tell everybody the good and the bad and the ugly and the storyline as to what happened. Because I write about Medicare, I read everything I possibly can and stay on top of things. So some of the stuff I talked about at the very beginning of this stuff happened yesterday, or some of it happened this morning. Okay. So I just always I'm happy to share the latest of whatever is going on with Medicare.
Absolutely. So, Bonnie, we have about 4 minutes left. What final advice do you have for our listeners concerning Medicare for 2026?
Yes. Number one, if you haven't read your annual notice of change, please get that out. So if you receive a piece of mail from your insurance company, don't throw that one in the trash, because that's what happens a lot of times. People throw it in the trash, go dig it out. If you didn't receive one or you threw it in the trash, call the 800 number on the back of your insurance card and tell them you don't have the annual notice of change, and see if they'll mail you one. Now, oftentimes they can tell you how to go on their website and get it so you can see it right then, which is, yeah, you're right. So that's a novel idea, right? So, but you'll want to immediately go over that annual notice of change to see what it cost you this year and what it's going to look like for next year. If you didn't get it, make sure that you do get it. This year, it's more important than ever to contact a broker, because if the plans that your company is with, if they're terminating those, then you can't call that company because they don't have anything to offer you. And if you do call them, they're gonna for the other companies that do have it, yeah, they can just offer you whatever they have. And because there's so much disruption, so much change with all the companies, you'll definitely want to have everything compared. And then prepare yourself for higher copays, less benefits, everything that I talked about that's going on with the drugs. Okay. Your deductible is increasing from $590 to $615. The federal government has not released the Part B deductible or premium. That should be any day, but it's projected to go up from 157 to from 185 to 206. And then for the for the deductible, from 257 up to 288. Those are big, big changes. And then also people on medications, if you are on a tier 3, 4, or 5, and you get that deductible hit, the 615, just know when you go to the pharmacy, you can ask them to divide it out so you can pay for it over the course of a year instead of having that big hit.
Absolutely. Well, Bonnie, we are almost at the top of the hour, and I can't thank you, Sarah, and I can't thank you enough on behalf of WCEG Network for a wealth of information here. Again, for our audience and listeners, Bonnie Dobbs is a broker. Do your due diligence, check and have conversations with Bonnie. You can call Bonnie at, I just lost my place here. Bonnie, excuse me, 770-373-7541. Go to our website at www.insuranceandotherredtape.com. and have a conversation and let Bonnie know what you have, and let one of her or her agents have a conversation with you, and they can compare, right, or what you have and what's available.
Right.
And it's like it's anything else. Every year you should be having this conversation with your insurance agent, with your financial advisor, things of this nature.
Yes.
You should do the same thing with Medicare. Do your due diligence and talk to a broker. And Bonnie Dobbs is one of the best. She is the queen of Medicare and other red tape. So Bonnie, our hearts love your hearts. Thank you for being with us. And also want to remind our listeners, our next show is on Tuesday, October 28th from 5 to 6. We will be having Kim Schooler for her 5th year on financial abuse and how to spot it and avoid it. And we look forward to seeing you then. Thank you, WCEG Network and Penny Rogers and the board for this platform to educate and inform our community. Our hearts love your hearts. Thank you.
Thank you, ladies.
Thank you, Penny. Thank you, Celeste. Thank you, Sarah.